Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about pains in the head and the neck and in the shoulder areas, as well as the relationship to TMJ disorders. Now we're going to do this from the perspective of a registered massage therapist who has a focus on TMJ syndrome. Today we have Julie Poulin with us. Welcome to the show, Julie.
Hi.
Glad you could make it today. Before we begin in talking about pain and TMJ disorders, could you tell us a little bit about your area of expertise?
Yes, I specialize in TMJ massage therapy, which is the temporomandibular joint and its dysfunctions, as well as face, neck, and shoulder pain.
Terrific. So how did you get started in this field? I don't know many people who do quite what you're doing.
I actually developed TMJ dysfunction after a car accident in 2007. Which left me with a lot of pain and headaches and limited movement of my jaw. And I couldn't find an RMT who specialized in TMJ rehabilitation. And therefore, I started my own journey. Started researching, experimenting on my own to get some relief, asking questions, and was able to assist myself in reducing my pain and increasing my range of motion and also my quality of life.
Terrific. That sounds like a great personal story that you have to it. Now, in terms of being a registered massage therapist and getting to the point where you are now in terms of treating people with TMJ disorders, how long have you been active in your field? What type of education have you taken to get to the point where you're at now?
I studied at Collège Boréal, which is a community college in Sudbury, and have been practicing for 14 years. Specifically in relation to TMJ, I've been practicing for 6 years. And have also taken, in addition to the regular massage training, various courses related to head, neck, face, and jaw dysfunctions throughout the years.
Ah, terrific.
Yeah.
That helped to create your specialty, so to speak, with regards to your massage approach to TMJ on top of your training to be a massage therapist.
Correct.
So what type of services do you provide in your practice now?
I provide rehabilitative massage therapy for various injuries throughout the body. However, my passion is in treating TMJ dysfunction. It represents approximately 80% of my clients.
Oh. What are the most common symptoms that you see in your patients?
The most common would be jaw pain, headaches, limited movement of the jaw, clicking or popping of the joint, pain with chewing, or even in some cases locking of the jaw.
So it could lock open or it could lock closed?
Correct, yes.
So how much of a role do you think stress plays in these symptoms that you just mentioned?
Well, stress manifests itself in the body in various ways, and in some people it presents itself in the form of teeth clenching or grinding, or in others tensing up of the neck, face, and shoulder muscles. Posturally speaking, stress posture is the rounding of the shoulders, the neck moves forward, and then what happens is that the jaw is no longer in a neutral position, and the muscles of the TMJ joint actually have to contract in order to hold the weight of the jaw, which can then trigger many of the symptoms that we mentioned earlier.
So from your point of view, how might headaches be caused?
The muscles of the head, neck, shoulder, and jaw all have the potential to cause headaches when they are stressed or overused. A muscle can elicit a headache to a specific area due to a trigger point. And a trigger point is a hyper-irritable spot in a tight muscle. Several such muscles that can cause headaches would be the suboccipital muscles, the sternocleidomastoid muscle, trapezius, scalenes, or temporalis. Postural imbalances, bad sleeping positions, injuries, clenching, squinting are just some of the examples of potential causes of headaches in the body.
So looking at this further then, what do you see as the relationship between the TMJ, the temporomandibular joint, and the head and the shoulder and the neck?
The body is always trying to achieve balance. It's one of its main goals. When one area isn't in its correct anatomical position or is injured, the muscles, tendons, and ligaments are put under stress. The result is soft tissue compensation, which usually results in pain, headaches, or even sometimes both. A tight muscle in the head can cause a muscle of the jaw to be affected, which can affect a muscle of the neck, which can in turn affect a muscle of the shoulder to be connected. It's the kids' song, the hip bone's connected to the, it's that concept where everything is interrelated. However, there's no particular order as to which is the primary area that's affected and which area would be secondary, therefore the compensatory area.
Mm-hmm.
This is why my approach to treatment is to treat all of these areas in order to achieve maximum results.
So people with TMJ disorder, some people suspect that they have it, other people don't know they have it. They may have symptoms, but they don't know what's going on. How are TMJ disorders actually diagnosed?
Most people who suffer from TMJ have been diagnosed by their dentist, family doctor, physiotherapist, chiropractor. And typically the symptomology is the indication for the diagnosis, such as pain in the jaw, locking, popping, clicking, or even effective movement of the jaw.
So given that, if somebody actually knew that they had TMJ, it was determined and diagnosed that they have a TMJ disorder, how would you go about treating, the related problems to that, such as, the headaches we talked about, or the relationship somehow in the head or the shoulder or the neck?
Well, my approach to TMJ treatment includes addressing the issues in all those areas, the head, neck, and shoulders, as they are all interrelated. Forward head posture is actually very common in TMJ sufferers. Addressing this issue is essential to the overall goal of diminishing symptoms of TMJ. Realigning the muscles of the head, neck, and shoulder means that the jaw is in a neutral position, which is stress-free, and that these muscles are healthy and strong.
So with regards to massage now, because you're a massage therapist specifically, what type of massage do you perform on people with TMJ disorders? At the beginning of the treatment protocol, at the end of the treatment protocol? Could you explain a little bit about that?
Yes, well, I use several different techniques in my approach to treating TMJ. There are myofascial techniques, craniosacral techniques, trigger point, and Swedish massage techniques. And within these techniques, I also incorporate intraoral massage. This is a treatment of the muscles inside the mouth that are performed with a gloved hand in order to release the small, intricate muscles that are responsible for opening and closing the jaw. Because every individual's symptoms are different and symptoms vary day by day, I take my treatment cues from the goals of my clients. Therefore, if someone comes in with a headache that day, the goal of the treatment will be more geared towards alleviating the pain from the headache. If someone has been having issues with opening their jaw and on a particular day, the goal of the treatment will be that. Therefore, my approach to treatment is to really go with what the client is feeling and not to predict what following treatments will be like.
So, is your massage then actually changing something in the patient, or is it making them feel good and providing relief of symptoms? So what's actually happening with the treatment that you're providing?
Absolutely. I've had clients who, due to pain from chewing, were on liquid or soft diets. And after several sessions, they were eating regular foods, and some were even crunching into carrots, which they thought was impossible. Others have had chronic headaches who are now headache-free. In some cases, my clients have had such tremendous pain that they couldn't open their mouth more than 4 centimeters. And after several sessions in addressing the muscles inside and outside of the mouth and jaw, we were able to achieve full range of motion. So the goal of massage and TMJ treatment is to improve the quality of life of these individuals.
So what's your success rate then with patients who have TMJ disorder? And how often might patients have to come back with symptoms that are related to the TMJ disorder?
Since 100% relief is almost impossible because it is typically of a chronic nature due to clenching, my goal is to get my clients between 80 to 90% better. And to me, that translates into having no pain day to day, but with a few flare-ups throughout the year. So initially, I would see a client once a week for 6 to 8 weeks. And then once we've achieved a healthy muscular environment and my client is pain-free, the mouth is opening better, the clicking or popping has been reduced, then we are put on a maintenance schedule, which is seeing them about every 4 to 6 weeks.
So that's getting them out of pain. That's, I imagine, the reason why a lot of people come in to see you. They have one type of pain problem or another. Now, extending beyond that, how do you believe that your approach will be contributing perhaps to overall wellness?
Well, for several reasons, but mainly for alleviating pain. This changes a person's quality of life, and anyone with chronic TMJ or even any type of chronic pain knows that even the simplest of activities during a flare-up can be daunting. I make a point to equip my clients with home care exercises. That way, they are taking responsibility for part of the treatment as well. Massage therapy isn't 100% of the treatment protocol. Exercises, including stretching and strengthening, are instrumental in the progress of correcting issues related to the TMJ. Although, TMJ treatments aren't very relaxing. No one has ever fallen asleep on my table during a TMJ treatment, and especially, with the intraoral massage, there is some discomfort associated with that. However, people are willing to put up with this discomfort in the treatment because outside of the treatment, it alleviates the pain, and then that in turn increases their quality of life because it reduces the stress from being in pain.
Exactly. I couldn't agree more. I mean, people with TMJ disorders, they may have been having problems or headaches or neck aches or problems in the shoulder. They may have been having that for months or years, and the effect on quality of the life is tremendous. So, if the treatment isn't the most comfortable for a very short period of time in terms of the time of the treatment, as well as the period of time that they have to come and see you, that's a small price to pay for what they're ultimately after, which is no pain and improved quality of life.
Absolutely, yeah.
So do you have a few tips for people who are looking to understand more about TMJ disorders and pain in the head or the neck or the shoulder or so on?
Posture, posture, posture. Most of us spend the majority of our day sitting, and the only time that there is mobility is from one sitting position to the next, office chair to car, to kitchen table to couch. Reverse your slouchy posture. Strengthen your back, stretch your chest muscles, and get active. And the second piece of advice I would give to people would be, do not become your pain. There are many different forms of treatment that you can benefit from. Keep trying, keep inquiring until you find the right fit.
Great, those are great ideas. Now, if someone were looking to find a registered massage therapist, what should they know? What should they look for?
Well, ensure that they are a registered massage therapist within the province of Ontario. And typically for a more therapeutic approach to treatment, I would recommend people seek out massage therapists in a chiropractic or physiotherapy setting. As well, ask friends and colleagues for recommendations.
Okay. Now, I'd like to thank you very much for being on the show today. Now, if listeners want to get in touch with you, how can they do that? What's the best way they can contact you?
They can visit my website at www.tmjmassagetoronto.com.
Okay. Fantastic. Once again, I'd like to thank you very much for being on the show today, sharing your expertise and insight. I'm sure you'll be able to help a lot of people with this advice.
Thank you, Paul.
Thank you.